This is The Conversation on Hawaii Public Radio. I'm Chris Vandercook.
I'm Beth Ann Kozlovich. What if we were to tell you you're a drug dealer? If you've ever given a friend or family member one of your prescription pain relievers, you could easily be called a drug dealer. According to the latest national survey on drug use and health, over 70% of people who abuse prescription pain meds got them from friends or relatives. Only about 5% got them from a drug dealer or over the internet. So while you may not land in jail, you might want to ask yourself, could my friend or relative be abusing drugs? Robert Saenz manages, coaches, and advises physicians across the country on what he says are the very necessary elements of safeguarding medical practices from drug abuse. And he's in Hawaii to speak at the Hawaii Pain Management meeting that starts today. He joins us this morning. Good morning.
Good morning, Beth Ann.
And welcome to Honolulu.
Thank you for having us here this morning.
We hear a lot about the abuse of prescription drugs, so much so that it's almost fallen into the humor category. And we've seen movies with people who are clearly messed up on drugs and prescription drugs, and people are somehow winking their eye at it because it's prescription drugs. Have we still not gotten over the fact that a drug is a drug is a drug?
No, I don't think we get it. In fact, it took the White House, the Office of National Drug Control Policy, this year to finally put out a statement. It was in April of this year, or of last year. I apologize. That declared prescription opioid abuse the number one drug epidemic in this country. And it is exceeding all other narcotics such as heroin and cocaine as far as abuse. And it's easily available, readily available in almost anybody's medicine cabinet.
And people think that they're doing such a nice thing or a good thing when someone close to them says, oh, I don't feel very well, or, could you do something to help? They don't really stop to have the thought, could this person who I know and love potentially be abusing drugs? Well,
and you could, any one of us could unwittingly addict someone to a narcotic that was prescribed to us. For example, your spouse or your loved one claims that they have backache, and you reach into your purse or your medicine cabinet and say, here, this worked for me, and you're giving them some hydrocodone or Vicodin, and because of their body composition or their tolerance level, they may become so dependent on it, and they take it once, twice, three times, and then they become addicted, and it becomes a problem. And doctors don't want to deal with some of these patients that come to them addicted already. Most physicians are not addictionologists, and yet they're prescribing a lot of these narcotics because they're facing this epidemic themselves.
So how can it be that they can prescribe these drugs but not have a full knowledge about how addictive they can be?
Well, they do, but what happens in the rapid pace of healthcare today, where physicians are seeing 50, 60 patients a day, and they have maybe 5 minutes with you to do an assessment on your situation, sometimes it's easy just to keep prescribing for the symptoms, and without proper testing of your patients. And that's what I'm going to talk to the doctors here today and tomorrow about, taking measures to evaluate your patient, do urine drug screenings to make sure that the medications you're giving them are actually in their system, or that the metabolites don't show that they're taking too many. Also conduct checks. There are databases here in Hawaii where you can check to see if other doctors are prescribing the same medicines to your patients. Sometimes patients will see 3 or 4 doctors, and unbeknownst to them, they're mixing narcotics that are very dangerous, that could not only be addicting but could be lethal.
We're getting too much of the same one because they know that they can't get more than a certain amount from a particular doctor, so they will have several who don't know that they are each prescribing the same thing.
Correct. And then there's a black market also. There's another issue that there's people who are capitalizing on these people who have become addicted or dependent on them. And they're selling these narcotics on the streets, and they have a tremendous value. Some pills sell for as high as $100 a pill.
What would that be?
Well, it depends on your region, but OxyContin is one of them that can sell for, depending on the demand, from as little as $5 a pill to as much as $150 a pill. There is no I guess, spectrum on the pricing of the pills.
A standard black market value.
Exactly. No fair market value.
But when we've talked in past about why they've had collection of prescription drugs and why to get rid of them in an appropriate manner, it's precisely for this reason, or aside from the fact that they can wind up in our water supply and other places where they shouldn't be, they can also wind up in the black market.
Correct. And one of the things that I like to remind people of is every day in the United States, and that includes where we live in today. There are 2,000 children, I call them children, between the ages of 12 to 17, that will take a prescription opioid today. The sad thing is they will take it without a prescription. They obtained it from their parents or relatives' medicine cabinet. And there is also an alarming trend now of teenagers that are having these checks parties.
Right, pill parties.
Pill parties. Again, it's easier to obtain than trying to buy marijuana on the street or cocaine. You can just get these from people you know and then mix them in a bowl.
Right, for a lot of people who don't realize that these are extremely popular forms of, dare we say it, entertainment at parties where kids will each have their own potluck, but instead of bringing, brownies and all kinds of other really okay goodies, they're bringing the pills from their parents' cabinets, and they're all mixing them in a bowl and saying, who's taking what. And
right. Yeah, it's pretty sad that that now you have these mass texts that go out in high school and college that say we're having a checks party at Beth Ann's house, for example, and everyone brings whatever they can, mix it in a bowl, and if you have alcohol, great. It sounds like fun. The kids, as you said earlier, think that these are safe drugs, quote unquote, because they were prescribed by a pharmacist and a physician. In fact, they're just as dangerous as any other street drug that we commonly know as heroin or cocaine, for example, and lethal.
They also have a different cachet, because when we've talked to kids and they've sort of rated drugs and what they would take or what they wouldn't take, some kids have told me personally, I wouldn't do meth because, that's a homeless person's drug. I wouldn't take that. I mean, depending upon what's part of the social strata they fall in, they have these ideas about what is okay based upon their socioeconomic strata.
That's
if
true.
It's in mom and dad's cabinet and we have a certain, lifestyle that we're maintaining, it must be okay.
That's true, and on the other side of the coin there, Beth Ann, is that I don't want to alarm people. These are medications that are prescribed by physicians for a reason. They are effective if used properly and monitored closely.
For the person for whom they have been prescribed.
Correct, and so it's a delicate dance that doctors have to do every day. They have to decide: are you a high risk, moderate risk, or low risk patient? Can I trust you? At the same time, I'm trying to develop a rapport with you as a patient, and I don't want to have conflict.
So what's high on the trust factor list?
What's high on the trust factor list from a doctor's perspective? Well, one thing is a thorough evaluation when I first meet you, to do a history of you. And the patient needs to be honest. If they've had drug dependency issues or their parents have, they need to divulge that to the doctor. The doctor's not there to, I got you. It's to work with you. Also, if you have alcohol dependency, if you have any types of issues in your background of social issues that might have affected you, psychological issues, and also doctors are encouraged to conduct urinalysis screens to see what is in your system, and then while I'm prescribing you, I want to make sure that my medications are in your system if I'm a doctor. And if they're not, then we need to talk. I need to stop prescribing them to you. And so it's a delicate dance. You have to treat the patient.
Is with all that delicate dancing that doctors and patients do with each other, is there anything particular that you see happening in Hawaii?
Well, Hawaii is no different than any other state that I've traveled to in the last year and a half. We've literally been going to state every week. Been from Florida to California. And you have the same problems here with the same medications. You do have some other issues with ice or methamphetamines, but prescription opioid abuse is still by far the worst.
It's just like everybody else, and so we shouldn't think, things are different here.
Absolutely not. And that's why I'm here. I wouldn't have come all the way down here to spend 2-3 days to talk to these physicians if it wasn't an issue.
Well, thank you for spending a few minutes with us.
Thank you very much, Beth Ann.
Robert Saenz is currently the president of VIP Medical, a national healthcare consulting firm which manages and advises pain management practices. He's also the chief executive officer of the largest pain management group in Tulsa, Oklahoma. For 20 years, he was a federal law enforcement agent with the Department of Justice and a director of international affairs with the U.S. House of Representatives. He's in Hawaii to advise the Hawaii Pain Medicine Society, or the Pain Society, at its 2-day meeting beginning today. More on Facebook at Hawaii Conversation.